In Health Watch, putting the squeeze on heart disease, literally. This morning we continue our series, Early Keeps the Beat, with a look at a new low-tech treatment for serious heart disease. It's called Enhanced External Counterpropulsion, or EECP. Joining us is Dr. Deborah Braverman, a specialist in EECP. Good morning, doctor.
Good morning, Maggie.
First of all, who specifically is this treatment for?
This treatment is essentially designed for patients who have heart disease, specifically coronary artery disease and congestive heart failure, and typically patients who have already tried surgery or stents or other kinds of treatments and either failed those treatments or didn't get sufficient relief, and now they turn to an alternative treatment known as EECP.
We're seeing it done here. They put basically straps around the legs.
We essentially use oversized blood pressure cuffs that get wrapped around the patient's legs, and in sync to their heartbeat, the cuffs squeeze and release, and what that does is promotes blood flow throughout the body, and particularly in and around the heart, actually recreating the benefits of aerobic exercise in terms of your circulation.
And what does it do for the arteries in the heart?
So that's really the greatest news of all. What it actually does is helps to heal the arteries to a certain degree by reducing inflammation in the arteries and by increasing nitric oxide, which is a substance that expands the arteries and allows them to let more blood flow through. Also by bringing about new cells to line the arteries and actually change them from the dysfunctional arteries that are not working properly in heart disease to start bringing more and more blood to the heart.
That's a wow.
It's a big wow.
Why don't we hear more about this?
Well, you know, in the United States, we really focus on high-tech medicine. We think that high-tech may mean better results.
Yeah.
And in the case of EECP, that's not true. That this cutting-edge treatment, in a sense, has no cutting involved. It's a non-invasive treatment that really is bringing about incredible success rates to some of the sickest heart disease patients there are.
You would think that it wouldn't be a last resort, as you said, but a first thing.
Well, it is becoming more and more common that patients are seeking out the treatment sooner rather than later. And at my home institution at the Albert Einstein Healthcare Network in Philadelphia, we actually integrate EECP sooner rather than later and use it as part of the continuum of care for all the treatment options available to heart disease sufferers.
All right, doctor, thank you so much.
Thank you.